I will be presenting the handling study, which is a study which is an initiative by the Arab Adult Arthritis Awareness Group, which is a special interest group and under the umbrella of ARLAR, as Dr. Basel said. And I will be, this will be the handling study, which is how are the rheumatology patients dealing with the COVID-19 pandemic in the Arab countries. I want to thank the steering committee in which they are from different Arab countries. The objective of this study is to evaluate the current difficulties faced by the rheumatology patient in the Arab countries during the COVID-19 pandemic. The methods of this study, the steering committee formed among the AAA members designed a 15 item questionnaire, and the ARLAR scientific committee was responsible for the scientific review and the validation. The ARLAR representatives disseminate this questionnaire on the ARLAR social media and patient association within 15 days. The AA group also advertised this questionnaire through the AAA network. So this study was grouped according to 3 countries of residence, which is the, as you can see here, our Levant and the Gulf and the North Africa, among 15 countries, which with a population of 333 million. And we will see the responders from responders for this study. As you can see, among from 8 May 2020 to 22 May 2020, we had the 2,190 a total of who participated in this survey, and they completed this questionnaire. Five responses with missing data, and 22 responses from non-Arab countries. Both were eliminated. So the total who were analyzed, 2,163 patients. And you can see here, the participant according to the country. We have the main countries are the Iraq and KSA and Egypt here. According to the region, we divided them according to the Levant, which is 35%, and the Gulf 33%, and the North Africa 32%. And by age distribution, the mean age of the participant was 40 years, in which they were similar in the 3 regions with a p-value 0.814. Here we divide them according to gender balance, and the females, as you can see, 75%, which is the they were most female with a percentage of 75%, and the male in comparison to male 25%. They were also similar in the 3 regions with a p-value 0.923. So we will see now the impact of COVID-19 on rheumatic management, and we will see the first one, the impact of COVID-19 on rheumatology visits. The impact on rheumatology visit was associated with the country of residence with a p-value less than 0.01. We can see the Levant less impact on the visits, while in the Gulf more remote visits. And the factors associated with negative impact of COVID-19 pandemic on the patient visit to the rheumatologist. Here we need to say that we are comparing the private sector to as compared to the public and university hospitals, in which the factors was mainly the gender, which is the female, had you can see higher negative impact with a p-value 0.08, and the region the highest impact was in the Gulf and the North Africa, and the lowest was in the Levant with a p-value less than 0.01. The medication non-persistency with a p-value less than 0.01, and the acceptance of teleconsultation with a p-value less than 0.06. What about the impact of COVID-19 on chronic medication? We can see here, according to the graph, 15% stopped because of shortage, and mainly you can see in North Africa. What about the impact on access to hydroxychloroquine? Around half had difficulty of access on shortage, and mostly in North Africa. What about the impact of COVID-19 on precaution during the visit? More masks were in North Africa, and you can see more gloves in Levant and Gulf, and around 10% take no precautions. What about the impact on mental health? We can see 76% had some impact on mental health, more in North Africa, and 50% had a minor impact on mental health. What are the factors associated with negative mental impact of the COVID-19 pandemic? The impact on mental health was associated according to the region, and it was highest in North Africa with a p-value less than 0.01. What about the impact of on the income? 60% had impact on the income, and it was less in Gulf, as you can see in the chart. Then we will be talking about the personal infection with COVID-19. The infection with COVID-19 was statistically correlated with the country of residence with a p-value 0.09. Among the, as you can see here in the diagram, among the 58 cases, 28 was in Levant, and 13 were from Gulf, and 17 from North Africa. Now we will be talking again, like the previous study, about the attitude toward the telemedicine. And here we can see the main question was asking the patients, would you accept to have a teleconsultation? And the result was 98.8 accepted, and 50% they said through internet, and 48.8 through a telephone contact. What is the source of information about COVID-19 that you were following? Mainly 73%, as we all know nowadays, is about social media, which is we need to know that social media now acting it has a high impact on our patient. 51% television, and the source 8% from newspaper, 6% radio, and 30% from healthcare provider, 20% from friends and family. So I will be saying the take-home messages from the handling study, which is depending, number one, about the responses of patients to our online survey. We had 2,163 patients within 15 days. They responded to us. Their mean age was 40 years. Most common were the females with 75%, and they said about the home 48%. So what are my second take-home messages? It will be for COVID-19 has a significant impact on impact on rheumatic diseases management. Rheumatology visit 82%, and chronic medication 31%, access to hydroxychloroquine 47%, mental health 66%. Also it affected the income, which is 62%, personal infection 3%, and personal isolation, which is 47%. The take-home message is number 3. It is did they accept the telemedicine, which is it well accepted? 50% accept it through an internet with the highest in Levant, and 49% accepted through telephone, and it was high in Gulf.
The recommendation from both studies was beautifully done by Dr. Nelly and Dr. Lina. However, we highlighted the drug availability, the importance of the drug. Very important to improve telemedicine in our region, the Arla region, as we see that there is hesitation in this. Also following the drug interaction and the COVID-19 with drug use in rheumatology, mental health impact in rheumatologists and on also patient. We need to organize ourselves to have guidelines and to communicate with patient and with rheumatologists. So acknowledgement of this study, the steering committee, there are our members who helped in recruiting, and the reviewer from around the world.